roll call. And then we have a public comment from the nurse, physician assistant, um, Leslie Gregory, and she will talk about what she thinks about universal health care, and perhaps add in some tidbits on why she thinks it's crucial that we, as a state, have a universal health plan. So then we will address the question on the agenda by having you guys weigh into your past 10 months thoughts and your views in and around the single payer healthcare in Oregon, and any other issues and concerns that you would like to recommend to the task force by May 27th. Following that, we will have an open discussion period where you can talk about any topics that you feel are of significance to our project here. And we will have additional comments and then closing remarks from the staff. So that is what our agenda entails today. So at this time, I'm going to turn it over to Leslie Gregory.
Okay, thanks so much, Glendora. Good to see everyone. I just wanted to kind of cover one of the reasons that this is a real important issue in terms of health disparities. My nonprofit is called Right to Health, and I have been petitioning the CDC to declare racism a public health crisis for more than 6 years now. Wrote them a letter back in the day. They kind of uh, poo-pooed it, to say the least, and refused. Therefore, the head of CDC at the time was Tom Frieden, and he didn't even respond. He pushed it to the office of what they're calling minority health and health equity, which had declined. The head of that department declined. And so I've been very frustrated since then with all of the turnaround and upheaval with minority health. And then when you look at the violence that we've had here, fighting racism on the streets, and then the continued gun violence, and all of these things are related to the health of our communities and the disparities thereof. So in continuing to push this work, we also have now created House Bill 2337 that we have sent to Oregon Health Authority to push Kate Brown to declare racism a public health crisis here in Oregon. The bottom line is that if we're going to have health equity, and that means all Oregonians have access to the best of care and the most appropriate care for them, then we're going to need to do several things. One is we need to lower the barriers for health access. And one of the things we're going to do in House Bill 2337 is to create mobile units so that they can go out into communities and do the kind of screening, advice, referrals, etc., that is more appropriate than expecting these communities to come into care. The other issue, though, is if we can get health equity for all people, all Oregonians to have access to good health care, it will create a demand for more clinicians of color. And we know having more clinicians of color will also address health disparities. The other issue, though, is to end the hypocrisy in our country where we go to other people talking about their civil rights and their equity when we ourselves are one of the last developed nations that do not have the right for all people to have health care. So I think that's another big piece of where we need to work. We have a lot of work to do. The other issue is prevention is cheaper than cure. So if a person comes in and gets screened for heart disease and they avoid having a heart attack, the diabetes, these sorts of things, we save a lot of money. Right now, over $2.4 billion a year is wasted on health disparities, and this is a tremendous approach to addressing those health disparities. The next part of it, of course, is mental health. And that does not necessarily mean anybody of color, doesn't matter what color you are on the rainbow. Bottom line is you need access to good mental health care. We also know that having universal health care will increase the need for mental health practitioners, and again, increase the training for that type of intervention. And we are advocating for trauma-informed care in all sectors of our healthcare system. So you can see that we have lots of moving pieces, lots of reasons to do this. I'm happy to answer any questions that anyone might have in terms of why we back this work.
Thank you, Leslie. As always, you always rise to the occasion and bring valuable information and get right to the point. So at this time, if any of you have any questions for Leslie, please do. Floor is yours.
Leslie, this is Ada. Can you go into, you talked about the cooperatives going into the community. Can you talk a little bit about how that will help to reduce the cost? And is there any other further input that you would like to talk about how we will be paying for the universal health care? What are some recommendations that you can think of that would help us with, saving some of those dollars? You've already mentioned that. But again, how we may be able to pay for the universal health care. And then can you touch a little bit also on, speaking of diversity and trying to get more practitioners of color, can you, and the training, can you speak on, because currently now I think the training is like 4 hours. I know it's very minimal, but the type of training that would be necessary as we're trying to get more, clinicians of color to treat the community, and others in the community, how we can go about.
So there are a lot of different training programs for clinicians. Now, whether or not you want to go into med school, which is a big commitment, 12 years of postgraduate education can be really cumbersome. One of the things that can be great is if you get an undergraduate degree in any science-based in area. So whether it's chemistry, microbiology, anatomy, physiology, any of the undergrad degrees that have anything to do with physical sciences, then you can get a PA in only 3 years. You get your master's degree in a PA, or in some instances 2. So that's not you can practice medicine and still not have to go through all of that. You can get a BSN, a Bachelor of Science in Nursing. And that's just a 4-year college. And then there you are in nursing. And so these are some of the helping professions that people, like my mom, who started the protocol, had. Now, the other piece is, and again, even a 2-degree associate can get you a medical assisting degree, and that you can get out and start doing work in the community as well. Medical assisting, Concordia, I believe, has a medical tech. You can do lab techs. Those are undergraduate programs. All these things, they don't take a 4-year degree. But the other piece is to do your homework. Look around. You can get PCC's got some training programs. PSU has some public health in the public health department. So look around. There's all kinds of places where people are needed, and medical assisting is a pretty quick and easy. Even dental assisting. These are some of the places you can get some training. And then once you get your foot in the door, start to train. Often if you're a go-getter, your job will say, you know what, you're good at this. Let's send you back to school for your bachelor's. Hey, you're good with patients as a CNA, a certified nurse assistant, which is again, just a technical school, 6 to 8 months in some cases. And they say, hey, you're pretty good at this. Why don't we send you back to school for your undergrad degree, or et cetera. So those are some of the ways that you can get your foot in the door, get yourself started. In terms of the ways we can do this outreach, my mother started a mobile unit in Toledo, Ohio. That's where I'm from, if you can believe it. And she would go into the community testing people for cholesterol. All you have to do is fast for 12 to 14 hours, poke your finger, take a look at your cholesterol and say that, blood pressure, waist circumference, these are some of the biometrics that you can learn to test. And that's what we propose, going out into communities and testing for those underlying conditions, you know, that left our communities of color at risk for the virus. And if you do that, you now have prevented those underlying conditions. We could have saved tens of thousands of lives from this virus if people had listened to us, and we'd have our mobile units. Also, the mobile units would have been able to go out into communities, test for the virus to keep people from coming in. Those individuals that had tested positive, we could have sent them right home to sequester, avoid more people, contact with people, and more contagious. We could have given them a supply of some of the things they needed just to keep themselves safe, hydration, you know, cough syrup, that kind of thing, to keep them at home. Okay, and we could have put on them units, the vaccines, and they could have been delivered by people of color, reducing vaccine hesitancy. So you can see that we would have saved not just tens of thousands of lives, but also a lot of the cost of treating people on ventilators in pulmonary care centers, you know, the peripheral costs of the virus that we could have saved had people listen to us.
And
So
including the mental health piece, Leslie, the
oh,
mental health.
absolutely, absolutely. That's the whole point, avoiding people coming to care where they get more anxious.
And so this is why I'm trying to sort of target you to speak a little bit about the importance of the clinicians of color, you know,
absolutely.
why we're needing them, because if we don't have them, the current clinicians that we have, there needs to be an increase of training for those clinicians who have no idea of how to even work with communities of color.
And that's a big part of what we try to do. We train those majority culture clinicians on how to approach, manage, comfort, assure, and treat special communities. And honestly, it's a very difficult process because you can't talk to somebody about something they need to learn when they think they already know. And that's a big problem. When, you know, there's nothing so hard as unlearning what you know. And so it's very difficult. And we already know that very many, in fact, I think it was 2019, they ran a study of UAV or UVA med students who thought that Black patients had a different pain perception than other patients. So when you have this kind of disparity of education, it's a real barrier to health equity, obviously, but also to unlearning some of those behaviors so that you can then become a more compassionate and appropriate clinician. So these are very difficult. Now, in terms of where the funding is going to come from, because I know that's a big, big issue. First of all, there are huge COVID relief dollars that have been freed up and put out into communities. The problem is that many of us, people like myself who are trying to actually do the work, number one, we're not trained on grant writing. Number two, if we had the time to grant write, we would not be in this pickle. Exactly. And so we're looking for people to help us with that process and free up the funding. The other issue is there are already funds set aside for when something is declared a public health crisis. That's a part of what the declaration is. You mobilize the funds to those areas at highest risk.
Right.
So that's the other part we would like to get the funding from. So yeah, if anybody wants to help us with grants, yippee skippy. Looks like we had a question.
I do. I have a question for you.
Yeah, go ahead.
Where is 2337 right now as far as moving through Oregon's legislature?
I believe that, oh, didn't I just see, I think I just got an email a little earlier today that there's a work group that's been set up for it. So if you would go to the agenda of the, on the website of Oregon Health Authority, you may be able to see it on there. But if you want, I can let some of the other people on the task force, I think we meet tomorrow, know about that. And a good place to look, Facebook. There's a Facebook page for House Bill 2333. I think it's HB 2337. You can look it up. So we'll try and have people post info on that. How's that?
Okay, and you're interested in testimonials because I work as a nurse practitioner on a mobile health unit in Southern Oregon. So I'd love to do something to support this venture because I know how incredible being able to bring the health care to people's neighborhoods can be with people who are houseless, marginalized. So I would love to write testimony for that.
Woo! You know, you can also sign the petition, moveon.org. You can also sign the petition to fight racism as a public health crisis. You can do that as well. But that's great. Was there another question? Awesome. Good. I got to get finished charting.
I appreciate you, Leslie, for taking the time out today to make this important meeting and giving your input. That's very important. So thank you.
And anybody want to hit me up, I am on Facebook. And again, go to House Bill 2337. Happy to sign anything you guys need me to sign in terms of your bill as well. And thank you so much to Glendora and Ada and everybody. It's so good to see you.
Thank you, Leslie. And
We
I
appreciate
will reach out to you so that if you have the time, you can also present some of these important points to the task force on May 27th from 1 to 5 p.m. I'll send you some data on that. I'll send you an email with those instructions there if your schedule permits.
What day of the week is that, sweetie?
Oh gosh, when is May 27th, Oliver?
It's on a
27.
Thursday.
It's a Thursday. Oh my God, I'm actually off. I think I have a couple of appointments, so I may not be able to make it, but I'll do my best. So send me some stuff, okay?
Okay, I'll keep you informed.
All right. Good to see you, sweetie.
Okay, bye.
Bye-bye.
Thank
And
you.
thanks, Ada, for setting that up for us. As usual, she has always valuable input. So now we will move along. Would you guys like for me to go over the summary, or you have already gone over it? If so, we won't spend any time on that. It's a summary from our April's meeting.
Can we
Excuse
send
me.
you input, Glendora, if we have more to add on that, can we just send it directly to you?
Yeah, if
Okay.
you want to change some things about it, let me know.
Yes, okay.
Otherwise, if you guys have had an opportunity to review it, it can be approved as is.
Excuse me.
I did review it and I may want to add some more to it, but I did review it.
All right, thanks, Ada. Yes, Khalid.
Are we going to skip the roll call? Do we not need it today?
No, thank you. We're gonna do the roll call. It's important.
Okay.
Thank
All
you.
right, just checking.
Yes. Oliver?
Hi, Glendora. This is Brian. I can actually do the roll call.
Okay,
if you'd like.
Brian. Sorry, I didn't see you there.
Yeah, and so I'll just go through our roster, and it looks like some folks aren't here, so I won't linger on them too long. It doesn't look like Chelsea Eleanor's here, or Crispin, Bala, Jules Garza. Does look like Kevin Fitz is here. Kevin, are you still with us? Well, I see Kevin in our meeting. He is on mute. Tori Jeter, I do not see. Ellen Greenlaw. Lori Hoagland is here.
I'm here. Thanks.
Ada is obviously here with us as well. It looks like Craig Catalano is here.
But I'm having some kind of connectivity thing where everyone else freezes up. So I've missed a couple of things that have been said, but I think I followed things pretty well. So I didn't want to interrupt earlier. So
Yeah, Craig,
if
and
I feel I've missed something, that like, oh, I really need to hear what they just said, but I was dropped, I will ask, but.
and from the Office of Amateur Tech Support, sometimes in these remote meetings that we found, sometimes if you disconnect and connect back on, that can help resolve connection issues. So if it does persist, that may be the option you want to try, but we have
Yeah.
we have you here now. Looks like Colleen Nelson is here.
Here, I'm here.
And then Tui Tran, I do not see this evening. And Ismail, it does not look like is here either.
Crispine is not here.
No.
So there's 5.
Glendora, would you like me to share the slide deck we have prepared?
Yes, please. Well, while he's doing that, then I think we can, anyone who wants to reflect on our past meetings, can do so. If you'd rather I call your name, or if you'd rather, just volunteer to speak, just raise your hand and we can do it that way.
Could I quickly ask if this is our last meeting, that means that we did not get an extension? Or it's
Well,
just that the committee is not going to be moving on?
We don't know yet. They have to have a hearing. They have not scheduled a hearing. So when they schedule a hearing and decide on the Joint Ways and Means Committee decide, then we will know the future of the CAC. Right now, we're all in limbo. We don't know. It's in the hands of the Joint Ways and Committee. Brian, do you have any other info you'd like to add to that?
Glendora, I think you've done a pretty good job of summarizing. So the House Bill 438 is in the Ways and Means Committee, which generally they do not do a lot of their activity on budget items until June. So I think, a couple of important things are linked to that bill. Is one, it primarily extends the time frame the task force has to deliver their report, which is currently now due this June, next month. It would give them the extra time to deliver their final report, and it would also appropriate some funds. With the delay in the task force, funding was some funding that was initially appropriated to the work of the task force was taken back, given that the task force was on pause for several months. So that passage of the bill would most likely come with some reinvestment of financial resources to the task force to do some work, and may come with some direction or some constraints on what that funding could be used for.
So as it stands now, if the task force does get an extension, do we keep meeting or we don't know?
The Consumer Advisory Council, is that specifically your question?
Yeah.
That would be up to the task force. The task force, the Consumer Advisory Committee's charter has it ending. And so I think, as with everything that the task force potentially has wants to continue doing, that would be subject to whatever funding would be given to the work, and then it would be up to the task force to determine what is next.
Okay.
So if that means re-engagement of this or a new configuration of a consumer advisory council, that direction would come from the task force, potentially with being steered by any direction that may be given in passage of House Bill 4 or Senate Bill 438. Sorry.
Okay. So we're scheduled to meet with them on the 27th, and that would be our final, potentially. Okay.
So, on the 27th, yeah, so just decide, what, if anything, you would like to recommend, and have the task force focused. But until the Joint Ways and Means Committee meet and decide on whether or not they will extend the timeline, June will be the last meeting for the task force. At that point, this project will cease to exist until further notice. The reason being, as you all are aware, is because of the COVID crisis that took priority and so delayed our work, as you well know. So that's where we are. So today, though, we're going to focus on what you guys would like to talk about as far as what you think should be a part of considerations and recommendations to the task force to make, if we get an extension, we would like to have some idea of what you guys would recommend to the task force. So open up the floor for this discussion. So if you want to go first, raise your hand. If not, I can call names. Okay, Lori.
Well, one thing that I think is going to be critical is engaging the residents of Oregon and having them enthused and aware and informed of the task force work as soon as possible. So I think that we need to have public hearings as a really important part of the extension so that we can, like, I know recently with the Ways and Means Committee had a Zoom forum for District 2, and people had an opportunity to speak to that committee on their priorities. And, I envision that perhaps if we had, ideally in person, but it would probably, it's hard to say, probably Zoom would be fine, meetings for each district to participate in learning about the task force work as well as providing input. I think that would be incredibly important. And I know SJR 12 with the Hope Amendment, I see that work and the task force work, ideally if we can get the SB 438 to extend, being very valuable together as an activity. And I think that I could imagine this public hearing space as being an opportunity for working those two thoughts at the same time. And, I personally have really been impressed with the Consumer Advisory Committee being so focused on the specific concerns of different areas of Oregon, breaking down barriers to access, focusing on Wi-Fi and transportation and a lot of the things that prevent people from getting healthcare. So, I hope we can continue to meet if they extend the task force, because I think we have a valuable role to play in this as well.
Thank you,
That's all.
Lori. Go ahead. Was someone trying to speak? Anyone else?
Yeah, Glendora, can you hear me?
Yes.
This is Ada.
Hi.
I too wanted to give my concerns and input on issues. Since the beginning of the Consumer Advisory Committee, I have had concerns of communication with the task force and with the tags. And my concern has been mostly as we're, going through a lot of this work, trying to keep up with the tags and all the meetings that we have, that there have been a lot of issues with our CAC members, of course, through all of this pandemic. And so we have lost half of our committee due to that, I believe. And then in addition to that, the community engagement, because of all that has been going on and because currently now our local governments are going through their budgets, trying to come up with ways of, what they can do to put the funds out there to all the organizations to keep things afloat for the community. All of that has been impacting trying to get everyone's attention so that we can engage the community and we can have them involved and know about which is what Lori was just talking about, what we're doing and how we need their input so that they can follow along. And so this is a real issue. I've been putting my feelers out into the community, but everyone is so busy. If you look at the local governments and all the nonprofits, they have been focusing most of their efforts with Zoom meetings every day, all day. And then in addition to that, staff have been reaching out to the communities to try to put out all these crises that the community members are having. So it's made it very difficult for our role, that as we're trying to engage them, it's even more so difficult because they don't even have time to respond to their email messages, let alone answer their telephone at times, because they're always tied up in meetings. So it's been very difficult as a CAC member, from what I have gone through, to get the attention because there's so many crises that are occurring in the community, and trying to get monies out to the communities who are in need and trying to deal with their crises. That it's just been a real hurdle. But I do want to say that I really appreciate the TAG's work and also the task force. My concerns have been with the meetings that I've been trying to keep afloat of with the TAGs and then the task force, is that also running into communication issues with the computers. We've continued to have that issue with people having ongoing, problems with connection and being able to hear. For example, the last meeting, I believe with the, I believe it may have been with one of the tags on either the governance or the strategies meetings, the volume was very low and it was very hard to even hear the meeting. When we're trying to follow with the CAC members, the tags, and we're trying to give input, a lot of times it's hard to give input because as we're listening to the tags, you would have to have the knowledge and to do the research and understand what they're discussing, and then trying to give feedback to them can be difficult because there's so many meetings, and you just we may not know how to do that in a timely manner. So that has been one of my concerns. The final one would be with the cost, with the tags and the governance, and then also just my concern with the continued meetings with the advisory committee, the importance of that with the community, that through all of this, even if there is an extension, I think, and even if we ourselves don't continue on it, I would like to recommend that we do have the CAC, if there is an extension, to continue being involved with the task force so that we can get enough of the community members, as I tried to do today with Leslie and giving her at least her input, that we have a lot of the very important community members who, if we, have the time to, get their attention and involvement, they would be able to give, I believe, a lot of critical information to the tags and the task force on a lot of these issues. So I just wanted to put that out there and follow up with what Lori was saying. And then, of course, with the bills that are out there, all those other bills, I myself took it upon myself to contact my representative, Tina Kotek, and Janelle Bynum, and there's some others, just to let them know what my concerns are with the Ways and Means Committee, and that we're trying to get the attention of the legislature so that we can continue to move forward and deal with the issues for improving our health care for the community as we're in this pandemic. And looking at this summer, I mean, we may have to repeat the same thing we went through last year with the smoke and more crises with the community, the mental health issues that I know the city and the county are trying to work on right now with the mobile units going out into the community. So there's a lot involved with all of this. And I think it needs a lot of more attention to continue with that engagement with the community through these Consumer Advisory Committee, and also working with the task force. Thank you.
Thank you, Aida. Points well taken. Moving right along, is there anyone would like to speak, or raise your hand? Yes, Colleen.
Okay, I guess I saw this as a little bit of a different question. I went back over some things we have talked about, but also thought about what are the issues that brought me to this community. So I'm going to put those as high priorities out there. The first one is that just basically we ensure coverage of services that keep people healthy, that we have a paradigm shift into greater wellness and prevention. I appreciated what our first speaker said about prevention and wellness, and I know there's been a lot of emphasis lately on that, but I think there's way more that we could do. But that we include the whole person, physical, including oral and dental, mental, emotional, whole person healthcare. And my particular issue is that we integrate in and cover holistic practitioners that can really work on a lot. They really work on a lot of chronic issues. And for me, it's been a lifesaver in terms of my health. So that includes naturopathic, Chinese medicine, acupuncture and herbs, and chiropractic, those really holistic practices. So my issue is to be sure that those practitioners are included in our healthcare, in our universal healthcare. I feel very strongly that we have to include high quality long-term care as part of this package. My experience is that a lot of long-term care is paid for by the state. So the state already has a huge financial burden in terms of long-term care, but we need to have we would continue and be part of this process, high quality long-term care that pays workers a living wage. Because people who need to be cared for deserve to be cared for by people who see it as a career and who get paid a living wage. And I want to see this be completely universal, mandatory for those who live in our state, and truly single payer, that we get the for-profit organizations out of healthcare. I don't believe that for-profit is a place for healthcare, and remove the a lot of the bureaucracy involved in innumerable numbers of insurance companies. That we can save a lot of money by having single payer, universal, and that we stick with that. So those are my issues. A little different, I think, from I saw it as a little different question than other people maybe.
No, you're spot on. There are so many moving parts to this. One can not go wrong in, you know, the recognizing the issues that are crucial to designing a holistic, comprehensive system, and bringing these topics back to the task force. So I think you guys are doing great. From day one, I never underestimated your ability to provide substantive information that, if listened to, will add quite a bit of value to the process. So thank you all for that. So next one. Okay, Craig.
When I was reading the question and talked about, I focused on that to advance a single payer healthcare idea. And in my conversations with people outside the committee, one of the things that comes up for people who aren't just automatically, oh, this is a great idea, the ones who are hesitant usually focus around the idea of cost. And will it be fair to the taxpayer kind of thing? And I realized that so many people just don't get the idea that the cooperative thing, prevention and working cooperatively will save us so much money that, like I think we get like, we should do it because it's the right thing appeals to many of us, that we miss the people who just don't get that and are only looking at a bottom line that they're misinterpreting because they think American healthcare is the way healthcare works, as opposed to the way healthcare fails. And so I think that's got to be part of the messaging, that, it's like, look, this will save not just people's lives, but money, for the people who don't seem to care about other people's lives. I know that seems cynical to say that, but I think that needs to be a much bigger part of our messaging, or at least something to focus on. Okay, my timer just went off. I've talked too long, or I feel I have. So
No,
thank you
we
for
got
letting me
time.
share.
You got time if you want to
right.
continue.
Okay, well, but I think I'm only just gonna, at this point, I think I've made my point, which is the people that I hear being most resistant to the idea are focused on what things cost as much as they are focused on what we would actually provide. And so I think that's a sort of barrier concern, if you will. Like, they can't get past the idea that this would actually save them money rather than cost them money. And so they're opposed to it. And I think there are some people out there that are convincible, that it's a good thing, and it's a good thing for everybody, both, as I might say, morally and pragmatically, because we'll all benefit. All right, now I think I'm done. Thank you very much.
Okay, thank you, Craig. Great input. And everything reflects your colleagues' input as well. So anyone else that we didn't, Kevin, are you there? Kevin? So are there any other members that are here, didn't get a chance to weigh in, or everybody here weighed in? And would you like to add something else that you've thought of since you last spoke?
Yes, Glenn.
Yes, Lori.
This is
Oh,
Ada.
Aida, okay.
I forgot to
Let me fix
mention,
I'll wait. I have some things to add, but go ahead, Aida.
that earlier I had spoke with another physician. And her concern was with, the Medicare, Medicaid portion for the insurance. And trying to get more people, involved with providing care for the community is that, and we touched a little bit on this, and I think Colleen did, the pay is usually too low for those who are involved with Medicare, Medicaid that, because their pay is so low, they choose not to be involved. And so with the universal health care, I think it would open it up a lot more. My concern is with the employer piece, because they're looking at their choice on what they want to offer to their employees. But then, of course, with the employees and what they receive, it may be limited and they may have to pay a lot for it. So that would open it up for the universal health care, so that those dollars would be put to better use, I believe, for the employees, and through with the unions on what they negotiate with their employers. But there's going to be, of course, some concern with the community, which I believe we need to have more input on this, is that as we try to come up with how the costs are going to be paid, and whether it's through, the taxes, our income tax, or through the employer tax or whatnot, and then looking at how we may be either improving the Medicaid or Medicare and making changes to those, how we would be able to reduce those costs. And it was mentioned earlier with Leslie Gregory today that if you have more preventative services that are being offered, Connie touched a little bit on, the more natural holistic health. And then of course, if we have more cooperatives involved, then that would of course reduce a lot of those costs right there. And then she also mentioned the grants, that if there were grants, we could, those dollars again would be adding more to the savings that we would have for those costs. So this is why, I'm trying to get more of the community involved and giving input on that, because I was trying to get in contact with the veterans. I thought it would be interesting to give their input. And I see that Glenn is not at the meeting today, and I thought he was supposed to be, but I think it would be important to give their input, the veterans, on their health piece, so that we would know what their concerns would be on their services, and then the cost through the local government on how they're getting their healthcare paid for through the government. Okay, I'm gonna let you.
Thanks, Aida. Great input as always. Lori?
Yeah, a couple of things. I had the experience of working in healthcare with Kaiser in the 1980s, when the people who were members had, in essence, a very straightforward one-stop shop where you could get your hospitalization, your long-term care, your medications, everything was kind of handled. And although they didn't do a great job, or they could have done a better job of opening it up to all the residents of the state of California where I was working, it was pretty amazing. And then over the course of about 20 years, I saw this system that was pretty amazing be broken into a very complicated system of, everybody having these, what they called skinny plans, where high deductibles, co-pays, all this stuff. And so there wasn't a one membership, you get these things. Everybody that belonged got all kinds of different things. And I guess my worry, and it's been there since my personal experience, is that we have to be so careful to keep out the commodization of healthcare so that we're breaking it into pieces. And an example of that is even with the recent America Rescue Plan, money going into subsidizing people buying insurance products, money going into helping people with COBRA, which is basically money going to subsidize a company and shareholders, as opposed to money going into healthcare. And so I still worry and fuss about how we can kind of have the people come together to take more personal involvement and responsibility in moving us away from that direction, because I think we're going to get a lot of resistance. There's a lot of people making good money from healthcare that, drives our costs above and beyond every other country and our outcomes below many countries. I worry about that, and I worry about the barrier of the mergers and how, in order to make this successful, we've got to be able to draw upon Medicare and Medicaid participants as part of the state plan. So I appreciate all the hard work that the task force and the tags are going to kind of looking at all the different states and the problems and the conversations. And I look forward to the meeting next week to get a little bit better sense of their thoughts on some of these issues that could, prevent us from going as far as we need to go with this.
Thanks, Lori. Great input as usual. And as you can see, all of these moving pieces interact, and they are crucial for us as a task force and to consider. So you guys are spot on, and I so appreciate your forethought and your reflections. Okay, Colleen.
Lori kind of reminded me that, well, maybe she did or didn't, I don't know, but I'm hoping that we have a chance as consumers to review the task force document so that we can have input on that. When we were first beginning, I asked the question, are we just going to respond to what the task force is doing? Or do we have input up front? And I feel like responding to what they're doing is half of our job. So are we going to have an opportunity to do that? Is that there's going to be some kind of document created of recommendations, correct?
Yeah, of what you guys are recommending to the task force to focus on in their considerations in designing the system,
I guess
the model, right? Is that what you mean?
No, what I'm asking is once the task force decides on certain things they're going to recommend, do we have a chance as consumers to say, hey, we like this, or maybe something needs to be changed? Are we going to have that opportunity? It sounds like we're not going to, and I thought we would at the beginning. Okay, Oliver, you're going to tell us.
Yeah, I don't know. Brian, did you, maybe Brian and I can tag team. Glendora, do you want staff to chime in on this question?
Yes, please do.
Maybe I'll start and let Brian wrap it up, because I probably will misstate stuff as I often do. Colleen, good question. So maybe it's to take a step back for some background. Because of the work of the task force is incomplete as of next month, with or without the extension, regardless, they're submitting a progress report essentially. That progress report doesn't put forward a full set of recommendations around a single player plan. They're not done with their work. And so there will be a task force report. It's a progress report. It's not a set of recommendations on how to create a single payer system in its entirety. The technical advisory groups have wrapped up most of the work, and that will be reflected in the progress report to the legislature. So I just want that as, hopefully that's helpful.
Okay, I didn't understand that. I thought they were going to have specific recommendations. I thought that's what they were asked to do.
They were, and they are working on those. I would say they more kind of have a blueprint is where they're at, but they have not finalized like the finance structure. They haven't finalized the revenue structure as well. So there's a lot of big pieces that are incomplete, so to speak. They've done some initial groundwork on, but it's not done. So that's one part I definitely want you all to be aware of. The other piece that I think might be helpful, and Brian probably can state this better, is as part of the extension, if the task force were to be extended, I think for you all as in your service as a member of the CAC, the task force is thinking more broadly about how to get public input as part of the extension. So they've had a number of explicit conversations about public engagement, both about how to get input on the design, but also feedback on the final proposal. That's something that's going to be a priority of the task force in the extension if the task force is granted. So how that happens in align with the CAC, if there was kind of a version 2.0 of the Consumer Advisory Committee, yet to be determined, but that is something that they are all looking for you all next week on the 27th. And I know Colleen, you'll be there, and Glendora will be there, and Aida, I didn't hear back from you, but they would love to hear, as the task force thinks about engaging the public, how else do they need to be thinking about engaging the public? And you all have already started having that conversation this evening. So
I will be there. I'll try to be at the meeting, Oliver. I'll try to make it. Yes. You can put my name on there. Yes.
okay. So I just want to help Brian. Is there anything else to add there? I didn't mean to jump in, but Glendora, as I heard some of these questions, want to, from a task force perspective, to offer our staff's comments.
Yeah, I appreciate the information. Thank you.
No, Oliver, I mean, I think you captured it. I mean, the task force has, I think, engaged in a lot of conversation about what the second phase of consumer engagement and feedback. And I think that comes to your specific question, Colleen. How does the task force engage the public and consumers when there is a concrete set of recommendations, which, just given the pandemic and the delay, they're just not there yet? I think the only other thing to add is, as Oliver mentioned, there will be a progress report that will be delivered to the legislature. And obviously that will be a public document posted to the task force's website. And I think what we can do is make sure that that's shared with the CAC, and obviously the task force, if and when the extension gets approved and they continue their meetings into the summer, those meetings will have a public comment period. Which is always an opportunity for everyone, including CAC members, to engage. And I expect that once that progress report is issued, there will be interested members of the public who will be looking at that progress report and using the public testimony opportunities at the task force meetings to provide some input to the progress report.
Okay, thank you.
Well, thank you, staff, for weighing in. So is Kevin, are you back? Okay, so are there any more questions?
Yes,
Concerns?
Glendora. Are
Yes.
you? So a question I had was, are you also for this meeting coming up on the 27th?
I'm sorry, what?
For the task force meeting on the 27th, are you, well, are they expecting also that if there are community members who would like to give input, that they would be able to come to that meeting at that time also to give input?
Yes, they would have an opportunity for provide input during the public comment.
Okay. And
So-
then, okay,
Go ahead. No, go ahead. I was just gonna do some, overviewing. Go ahead.
I just wanted to put out another concern that I had. And this is dealing with the terminology for the benefits and services, which is medically necessary services. My concern from doing some research is that currently now, some of the physicians are having problems with, for example, making referrals to patients for specialty care. And there's some management organizations excuse me, that are limiting physicians for referring their patients, and they're wanting them to handle, you know, those issues themselves without making those referrals. So I just wanted to make sure that in the universal healthcare plan, that terminology, that if it's going to be there, also the practices, I had put down some documentation on the practices of the healthcare industry. There are current practices that they're using under the healthcare industry. Whether or not some of those practices will still be continued or not, or would those practices and policies also be improved upon? And if the communities will be having any input and engagement on those practices or policies, and also regulations would be another important piece for the community engagement.
Yeah, you guys, and that brings us back to what you guys are reflecting on now, and suggesting that the task force issues that the task force consider. So yeah, that is all part of determining an approach that's going to be comprehensive and holistic in nature, as to provide a full set of meaningful benefits to all healthcare consumers, without, focusing on their whether or not, or their social status, that's going to allow the model to be affordable for everyone. So yeah, those are critical issues that, because you've mentioned them, that will be passed along to the task force on May 27th. And at that time, I don't know exactly what the agenda will be as to how they will respond to your input, but or how they will share with you guys the method of carrying out your or how can I say it, representing your interests. But these are the kinds of issues that they want to hear about. So it can be designed into a system, given that we have extended time to be effective in our final recommendations to the Legislative Assembly. So yeah, those things are important, Ida. Go ahead.
Glenda, I had a couple things. One is I will be at the meeting. I don't know if I sent a note, but I plan to be at the meeting. And a couple of questions. If we extend our group, which I'm hoping we can, will we be able to, I guess I would like to put a priority on making sure that we can fill some of the empty spaces, because I do feel like it would be helpful to have more of us, to get back up to the 13. And that would be a priority of mine that I want to bring to next week's meeting. And then the other thing is, I'm a little concerned about representation with the task forces and, knowing our group for Spanish-speaking undocumented residents, because, I have so many personal stories of patients treating their diabetes, for instance, in the emergency room, because that's the only type of care they have. And it's just egregious to me at times that we'll put them through the most expensive care, which is totally inappropriate when they have a chronic health condition. Anyway, and I wondered, because I haven't been able to attend the task force meetings due to work reasons, but do we have a good voice looking into that group?
Yes, you do. And so, and so this is why the CAC is such a vital component of the task force. Because you guys present with not only just lived experience, but some of you are professionals in and have a great responsibility in delivering the services. So because of everybody living in different regions throughout the state and your different professional contributions to the system, and your lived experiences as far as understanding the benefits that you have through your health insurance. These are all areas that the task force uh, uh, expect to be focused on, and how best you guys are recommending for us as the task force members to think about. And so we have to take all of your information and and develop it and present it in such a fashion that it really tells a story about how important universal health care is in eliminating the disparities and achieving health equity and equality for all. So, yeah, so that's where we are with that. And because I am part of the public uh, I represent public input as a advisory member as well. So when you guys can no longer represent as health consumers, I will have heard what you have said and will be able to emphasize further to the task force about what you guys have suggested and recommended. So it won't just fall flat because it's important. And so I will do all that I can to make sure the task force, considers what you've said during these 10 months of meeting. If by any chance we are not allowed to exist beyond, June 21st. Does that make sense? So I want to emphasize again that all the input that you have provided here will not just die by the wayside. As far as the task force not being informed, and I don't want to use the wrong term, but I'm trying to be what they say politically correct in expressing what my expectations of our task force work ahead, so that you guys will feel like your voices were heard and your recommendations were taken seriously, and they will build up on it in their recommendations to the Legislative Assembly. So at this time, I am going to turn it over into the hands of the staff for any closing remarks or anything that I have left out.
Glendora, can I, before we transition to that, I'm wondering, because we have Colleen, Aida, thank you, Lori. It sounds like you'll be attending next week. would it be helpful to spend just a few minutes, Glendora, giving folks an idea of what to expect next week for that hour between 4 and 5 with the task force?
Yeah, go right ahead.
Okay, I didn't know if you had thought about it. Do you want staff to kind of?
Yeah, go ahead. I think I've said enough, so it's good for them to hear another voice. Go ahead.
So I think, I just want to, if it's okay, just to spend a minute or two, see what questions. Obviously, the joint meeting with you all and the task force is 4 to 5 next Thursday, right? So I just want to make sure that's on your calendars for those who can attend. We'll send out some additional thoughts at the end of this week. But I think if I'm right, Glenda, I don't know if you've had if you've had a meeting with Bruce Goldberg, he's the chair of the task force. I think the thought is that Glendora and Bruce will offer some opening remarks, highlight some of the input that you all have provided to the task force, where that input has been helped inform some of their initial policy development and their proposals, and then turn it over to each of you and have each of you spend 2 to 3 minutes, as much time as you need, to kind of go through what the highlighting what you just had that conversation around. So Colleen, for you to share kind of your approach in terms of what's important, whether that's holistic medicine and inclusion of alternative practices in a holistic model of a single payer system, or Lori, some of your considerations as well. So I think just to be as prepared, and we can send this out in a question that's helpful, just to be prepared with some remarks. And I think it'll be somewhat of a kind of a round robin. Glendora, I assume you and Bruce will kind of facilitate and call upon each of you serving as a member of the CAC, and then we'll turn this over to the task force and see what questions and see what thoughts that they want to share. And then it's an opportunity to think about that continued engagement question. So I just want to kind of lay out what to expect next week during that hour, so everyone feels prepared and comfortable. And if there's any questions, please feel free to ping Brian or I, and we're happy to provide any additional background or support as you all need in preparation for next week's task force meeting.
Yep.
One
How does
other-
that sound?
Sounds good. Can we get people to send testimony, not just us, but the community at large, for SB 438? Is that, even though there's not a hearing, can they send testimony now?
Yeah, SB 428. I think though it would be appropriate. Let me know, Brian Oliver, if I'm not accurate in this. If we wait to learn when the hearing will be, that is where they will take the legislators, Joint Ways and Committee will will take our testimony into consideration. That's the time for it. So we don't know when that hearing will be. So that's beyond our control. It's left to the Joint Ways and Means Committee to set a hearing.
Excuse me, if I already supported that bill, will the Ways and Means Committee also get that, as well as the legislature when I supported it, or do I need to do it again?
I think you would have to submit it during the hearing session. No?
No.
So let Oliver go ahead.
Yeah, sorry, Glenda, I don't want to.
That's
so
okay.
Colleen, to answer your question, if you submitted it when the bill received a public hearing, it's on OLIS.
Yes.
And so legislators and Ways and Means have access to those. If you had
So,
written testimony.
They know I'm supporting. Okay.
Yes. Yep.
So I hear you saying she does not have to resubmit once the
Right.
hearing has been set, Oliver. They'll go back and retrieve her initial testimony.
Yes, if that's what they choose to do, yes, because if it gets scheduled, it'll most likely be scheduled a work session, and work sessions, they will not take additional public testimony because the bill will have had its public hearing in Senate Healthcare when it was heard back in February, March. I don't recall the dates. Brian may have those.
Okay.
Okay, thanks. So Colleen, that's you
right? I don't have to
Answer
do
your
it again.
question? Okay.
Glendora, what about any other bills that are out there that are still going through the legislature that where there would be impact with healthcare for other cultures?
Well, that's one thing I think that the task force should focus on, how to bring these different community interests to our forum to address and to think about how we are going to incorporate them into our recommendations to the Legislative Assembly. So if you guys run across bills concerning issues that you know are important to the process, you know, jot them down. So on May 27th, you can emphasize those issues and talk about those bills and explain how it is relevant to what to the task force and how important it is for them to consider. But there are so many bills out there, you know,
Yeah,
so
and this is why I have already done that by,
yeah.
you know, during our meetings, trying to submit some of what is already going through the legislature. But, you know, as the other groups are continuing to meet, have conferences and these virtual meetings online, you know, these are ongoing issues in the community of what everyone is trying to do with each of their different issues. And to try to follow all of that is, you know, it's a little cumbersome trying to follow every organization's, you know, interest with their bills and what they're trying to get the attention, you know, of all the community members, including the legislature, as they're trying to go through the, you know, the Capitol is a little bit, you know, difficult to follow.
Right. This is, and so you can see what a difficult time we are having just trying to bring forth those issues so that they are not ignored or left out in a system that it has so many moving pieces until it's frightening, right? So we're thinking, how are we ever going to pull together a comprehensive system that is going to be beneficial to all Oregonians based on the fragmented pieces that we have to pull together to make sure we're not just duplicating status quo. So yeah,
Okay.
we will keep forging toward a plan that is innovative and you know, comprehensive, so it can have real meaning and address all of the concerns that we know should be addressed, including Craig mentioned cost and quality. And this is what I see are two competing forces. And so we're gonna have to work hard and fight hard in making sure that the legislators understand that that we want quality to be considered over cost. And in order to improve quality, we have to be certain as much as we can on what is quality, who defines quality, and what criteria are we going to use in defining it, right? So whether it is through the lens of the consumers or the private healthcare sector or our legislative assembly. So yeah, a lot of work ahead of us, and the COVID, as you guys know, has slowed everything down, and it has not created public health issues, but it has highlighted where these issues, who the
The disparities, where the disparities are out there.
yeah, and it has highlighted the racial ethnicities of being uh, deprived of equity as far as the services and information. Um,
And
so
Glenn, I wanted to add before I forget also, and I think this may come under either the governance tags report that they're developing, or it could be even come under the strategies tags. This has to do with the prescription and the pharmacology information. I was doing some research and had seen that as far as the cost, trying to control the cost for that, that some, I believe it was some of the states or other countries are using to control their costs. They're using municipals that would have control over their prescriptions and the cost to bring the cost down. And so I don't know if that's something under the tags that they have looked into as far as the control of cost, if that would be an option for Oregon or not. And
in the determining how what in determining the how
And-
what revenue will be used to pay for universal health care. I'm sure that sounds like it's going to be one of the factors involved in that tag. So we're working on it. It happens to be one of the tags that I'm a member of. So we're working on that, trying to discern what is the best revenue approach when it comes to the sales, the progressive tax or income. How are we going to explain to the legislators which of those packages that's going to be the best to generate revenue to pay for the universal single payer health care
right, and so this is why I think it's even more so important to get the input from the community on that, because a lot of them, as what Leslie mentioned today, have input that they could be giving to the tax and the task force that would help to reduce the cost from what they see as preventative measures with services and benefits to the residents on keeping those costs low. And as I was looking at the numbers that was included in the report from the tags, I believe it was under the governance for the costs. I was a little perplexed at some of the numbers I was looking at, in particular with the underserved communities, in comparison with the progressive tax. Those numbers to me were a little off, and I had concerns of that. And I know it's not, I know you guys are still working on it, but as these reports are being developed, this is why I'm giving you my input on the timeliness of getting input from the community as the task force, and the tags are finalizing their information. That's a very important piece that should not be left out as you guys are developing your reports and making your recommendations and moving forward. Because that could devastate the communities currently that we're, looking at being devastated with this pandemic, even more so that if there's going to be another tax on top of the tax that they're already paying, that I know that many of them cannot afford. I think that it would be pretty important for the community to know whatever the end result of those recommendations are going to be, that we have that information in the hands of, you know, those important community members who need to know that before it is recommended, you know, to the legislative bodies.
Yeah, and those things I think I heard Colleen and Lori mention about we can't afford to allow the private sector health insurance exchange markets to continue to be the sponsors of our healthcare system, because their priority is profit first, profit
Yeah.
over people. And so we don't want to, you know, we want to make it clear that we don't want them making that decision. And we want the corporations to pay their fair share when we are talking about how we are going to generate revenue to pay for this. So yeah, that's those are important issues. Colleen, did I see your hand?
Yeah, I was just going to weigh in. I believe that there is data out there that says that a single payer plan will actually save money compared to what we're doing now.
Yeah.
But the other thing that I may be wrong about this, but I've always assumed that the task force is gonna put a broad stroke out there. This is what it could look like, and here's a few details, but there's an awful lot of details that are going to come down the line. And so I would hope that we get some kind of a concrete proposal so that we can debate it in the public square, so that we can have hearings, we can get more input, because it's going to, from the task force to legislation, it's going to be years. I'm sure of it. But we've got to have a starting point. And so I'm hoping that we get a really good starting point.
And I think at the May 27th meeting, you'll have the chair and the leaders of the task force to really weigh in and give you an overall summation of how the task force will be incorporating your input and into a report that we are required to make to the legislative assembly. So yeah, you're right. Keep those things in mind. So make sure that you write them down, and so you know you can share with the task force on May 27th.
Okay.
So 5:30, wow. Have we ever been you know, had so much time you know, available to us? So I don't know if there's anyone else who has anything to add or to discuss. Oliver, Brian, can you think of anything else that we need to know or make some sort of suggestions or provide more whatever to our first time interaction with the task force for the members?
Excuse me, what time is the meeting on the 27th again? Time of day?
From 1 to 5, I think, right?
But we're coming in at 4, right? We're not going to be in at 1.
Well, you
So
can
you're
listen
going
in,
to tell us
but
how to do that.
you can always chime in to listen in to what's going on, but your
Right.
input will be between 4 and 5 p.m. Is that right, Brian, Oliver? Yeah, your opportunity to speak to the issues will take place between 4 and 5 p.m. So
Thank
if
you
you
very
want
much.
to wait
Mhm.
If you want to wait until 4 or 5 p.m., I'm thinking it's okay, right, Brian, Oliver? Or you can join in anytime before then and listen.
Yeah, Glendora, that uh, on the agenda, that will be between the 4 to 5 hour. So that's
Okay,
so probably most efficient to join then. It is, all these meetings are live streamed, so you can also watch from 1 to 4 via the Oregon Legislative website.
But you're gonna patch us in at 4, even if we're there. Right? Are you gonna tell us how to do that in an email?
Correct. We'll give you the login
All
credentials.
right, good. Okay.
so any more questions? Any more added input?
Yeah, this is Ada. I noticed that Kevin is on the line. And also, I can't see, is it Kevin? Kevin, and I can't remember. Is there someone by the name of, there was
Mary.
another person, was it Amy or someone that was
Mary.
on the meeting? I
Mary.
don't, okay, so I don't see her right now, but I just noticed that they have not said anything yet. And I don't know if they're having some technical difficulties. Brian, have you talked with either of these members that they have responded about being to the meeting today? Have you heard from them and know if they're having problems?
I
And-
reached out to them, and so we know who has dropped off the list. So if the task force decides to keep the CAC as an active participant, then at that time, the co-chair will, who is the lead of the organization of CAC members, we will talk about how we will substitute and reach out to on the initial list to see if there are others who will fill in for the people who are no longer with us. And those people include Ismail, Tori Getter, Chelsea, Crispine, and at this point, Jules.
And is the Ellen Greenlaw, I see Ellen Greenlaw name, and also is there a who is Kathy? Kathy's name, I see Kathy's name was also on there.
Well, Kathy's not a member, and nor is she an alternative
Okay.
name. So
Okay,
Oliver, Brian, is she part of you guys' staff? Or is this someone who wanted to make a public comment?
and I saw a name earlier today that was on our
You didn't
you know,
register.
well, for people who had signed in on the meeting, there was another lady's name and I didn't write her name down. I think it was Amy or something. It was a female that was on our meeting, but I don't see her now.
I assume that was a staff member.
Okay.
Was there another staff member on?
No,
No, there was.
So maybe it was a person that was trying to do public testimony. Brian, do you know who that individual was that had logged in on our meeting?
And I do not. I apologize.
Okay. Do you know, Brian, what's going on with Kevin? Why he's not responding?
Ada, no, I know that Kevin's logged in and he's not reached out to me or outside of this meeting to let.
Yeah, so this has been an ongoing issue, Oliver, that I just wanted to bring up with this meeting that we have been having for quite some time, that we have continued to have this ongoing communication issue with members of our committee. And no one seems to know what the issue is. So again, I'm assuming it may be.
Sorry.
Well, I have reached out via the email that all of you got a copy of, and I heard back from most of you. Ron is absent, so I don't know what happened, but he had assured me that he would be part of these, he would be a participant to the end whenever the end was. And so he's not here, so I don't know what happened. And Kevin had indicated he would be at the meeting, so I don't know what happened to him, if he had some sort of login issues or just what. And everyone else have, except for Jules. I did not hear from Jules Garza, except for she had been inadvertently excluded from the emails to notify her of our meetings. But when I looked at the distribution list that Brian sent out with the agenda, her name was there. So I don't know what kind of, if, you know, personal challenges she's having with receiving her emails, because I have not heard back from her except for that tidbit. So
Okay. I do know sometimes with the emails, they go into spam sometimes when you're getting something from someone. And a lot of people don't know to look to, you know, into their spam in case that could be where they're going on their computer.
well, unless what happened to me was, I don't know where I did not receive notification. And when I looked back to check the email listing, some old email had been used for me, and I don't know how that happened. Because until then, you know, I was receiving all updated information coming from whomever. But sometimes these strange things happen, and so can't explain what's going on with those who are not reporting into the meetings, because I looked at my email to see if there were any notifications from Kevin, I mean, not Kevin, but Ron or Ellen. I didn't see anything. So I'll be following up with them if when we find out whether or not SB 428 is approved or not, and staying in touch with Brian and Oliver.
Yeah, and Glendora, if I can, I just want to be clear, and I think this follows up on your conversation last week with Bruce, is if Senate Bill 428 is continued, there's still a question, as all 5 technical advisory groups are closing out. The intermediate work group is now closing out, and the CAC. So it's, what does the continuation look like of all the body of work? So I think that's going to be a conversation for the task force towards the end of June, and definitely July if it's extended. So I would say stay tuned. We'll definitely, Glendora, through you as the chair, want some kind of official announcement one way or the other. But we need to let the task force have the conversation with you all next week, and then figure out if there are any next steps.
Right. So until then, thank you all. And if we don't know what's going to happen, but I'd like to see you all stick with it. And, you know, as whatever happens, we'll be back together again in a full functioning 13-member forum.
Yeah, and Glendora, just to follow up on Oliver's point and kind of follow up on one of Colleen's questions, I think staff will, through you, Glendora, ensure that the CAC members are kept up to speed and up to date on the progress of Senate Bill 428 through the process, and when and if that does go through, and what it means for the task force, and also making sure that CAC members know how to get access the task force's progress report when that does get finalized and publicized on the task force's website, just so people can follow and track that, because that will be the next thing for people to interact with.
So everybody understands that this is our last meeting. The June meeting has been postponed or canceled, right? And May 27th, between 4 and 5 p.m. is when you'll have an opportunity to share with the task force. And between 1 and 4, you can listen in to see what our conversation and topics will be discussed. So I guess